Hello, everyone. My name is Kay Gooch, and I'm the Director of Community Programs here at ARC. I'd like to welcome you all to our March webinar on the important topic of the emotional aspects of amyloidosis. So just to move on to our next slide. I'm having a delay here on this. It will move. Here we go. I'd like to give you a little background on ARC. ARC is a patient-focused, patient-founded nonprofit whose mission is to advance science to both improve and extend the lives of those with amyloidosis. And we have 4 areas of focus. One of those is looking at improving the speed and accuracy of diagnosis of the disease, and also helping us to increase our understanding of the natural history of the disease to identify new treatments, and looking at accelerating the regulatory approval and reimbursement for treatments, and then also enhancing the care and quality of life for people who are affected by amyloidosis throughout their journey. And also, I'd like to take a moment to thank all of our sponsors who have helped fund our webinar series today. We certainly do appreciate their generous support. And then just lastly, I wanted to let you know you will receive a survey at the end of the webinar, and it would be extremely helpful if you would fill that out. It does help us try to plan and look at topics for our next webinar. Also, during the webinar, you are able to add in any questions you have in the Q&A section. Feel free to do that. And so at the end, we will have time to answer those questions. So now I'd like to go ahead and introduce our presenter today, Dr. Meghan Beier. Meghan is a clinical psychologist at Rowan Center for Behavioral Medicine, and a faculty member at Johns Hopkins University School of Medicine. She specializes in helping people with chronic illness and disability navigate the emotional and cognitive challenges. Driven by a desire to improve the lives of those living with medical diagnosis, Meghan has supported patient advocacy organizations and has sat on national advisory boards for nonprofits. She's also shared her expertise with patients, families, and professionals from across the country, presenting on a variety of topics focused on living well with chronic illness. Meghan's also founder of Find Empathy, which is an organization and a podcast dedicated to supporting the education and growth of mental health professionals. So we're really delighted to have you here with us today, Dr. Beier, and I am going to stop sharing and let you bring up your slides for today, and we appreciate having you here.
Hey, thank you so much for the invitation and pulling my slides up here.
Okay.
I'm really thrilled to be here today. I'm also thank you so much for such a kind introduction. So as Kay mentioned, really what I want to focus on today is what can we do to live well emotionally when you're living with a chronic illness like amyloidosis? I'm going to focus on a few things. First, I'm going to give a little bit of some background, a little bit of research on what's the prevalence and impact of mental health challenges in amyloidosis, how mental and physical health can interact. And I'm going to spend the bulk of the presentation really focusing on what you probably came here for, which is what are some strategies for managing the ups and downs of living with a chronic illness. Just to give a little bit more background about myself, Kay said most of it, so I won't spend too much time here, but I am a psychologist at Rowan Center for Behavioral Medicine. Our whole practice focuses on helping people with chronic illness and disability. I have had the pleasure of being on faculty at Johns Hopkins, where I was both a clinician and a researcher. And I find that it's really important that we take what we know about chronic illness, medical conditions, and emotional health, and take it out of the academic center and really bring it to the people who need it. So people who are living with and affected by these kinds of diagnoses, which is why I wanted to create education, not only for people who live with chronic illness, but also mental health providers in the community. I often find that the people that I work with say that if they go to a person who is a mental health provider in the community and they don't have experience with chronic illness, sometimes there's some things that they have to spend time educating their therapist about, and you don't get to exactly what you're looking for right away. So if we can provide some back-end education, that's less effort and work for you. So that's just a little bit about me. I'm going to start with the research. So what are some common mood challenges and how do they impact daily life? So there isn't a lot of research on mood in amyloidosis, unfortunately. This is an area that I think could be expanded. But from what we do know, there's about 1/3 to 1/2 of people who are living with amyloidosis experience clinical levels of depression, anxiety, or both simultaneously. And what I mean by clinical levels is that everyone, no matter who you are, is going to experience things like sadness, grief, frustration, the spectrum of human emotion. That doesn't always mean that you are depressed or have a clinical diagnosis of depression or a clinical diagnosis of anxiety. Sometimes it's normal to have a reaction of feeling sad or frustrated about a symptom that you're experiencing. It's normal to feel scared and uncertain about the future when you're living with an uncertain diagnosis. However, if those feelings persist for longer than 2 weeks or more, and are consistent for most of the day, nearly every day, and they're stopping you from doing the things that are important to you, like spending time with family, enjoying hobbies, if you're still working, if they're getting in the way of your vocation, if you're somebody who volunteers, if it's stopping you from volunteering. So if those symptoms are getting in the way of you living the life that you want to live, then it's something to consider a little bit more. I also wanted to highlight something here is that with depression and anxiety in chronic illnesses, there tends to be some overlap between the illness and a diagnosis of depression. So it actually can be a little bit, unfortunately, easier to fall into a diagnosis of depression or anxiety because of this overlap. Let me explain a little bit more. So in a diagnosis of depression, what we're looking for is sadness, lack of interest in things that you normally enjoy, feeling bad or guilty. Those kinds of things are what we call affective symptoms, or kind of the way you're thinking and feeling. We also have somatic symptoms, which is the way your body is reacting. So that can be things like changes in your sleep, appetite changes, being more hungry or less hungry, feeling fidgety or agitated or restless, moving or speaking more slowly, difficulty thinking, cognitive fatigue or fogginess, and body fatigue. Now, I think you'll probably recognize that some of those symptoms are common symptoms that you might be experiencing. And so when you then add to that things like feeling guilty, feeling low or less interested in things that you normally enjoy, all of a sudden you're kind of kicked into that diagnostic category. So it's really important that when you work with somebody, you want them to understand the somatic side, and whether those somatic symptoms are coming from your depression, coming from your medical condition, or maybe a combination of both. And that can be a little bit nuanced. So what are some risk factors in amyloidosis? From the research, we know that people are more likely to have a diagnosis of depression or anxiety if you are older. Females tend to be a little bit higher. If you are experiencing more physical symptoms from your diagnosis, if your disease is more advanced, and more specifically for cardiac profiles, time since cardiac symptom onset. Some of these may not be surprising. It tends to be a little bit more distressing if you're experiencing more symptoms or your disease is more advanced. So I'll talk a little bit more about that when we are talking about how to address some of what you're feeling. Now, I'd like you to be involved in this talk, so I'm not just talking at you. So we're going to launch a polling question. I'd like everyone in the audience to share whether you have experienced something like depression, grief, anxiety, stress, or something else. And you can write in the chat, but I don't think the whole audience will be able to see it. But if you do write something in the chat, I can call it out. So please feel free to answer that question if you can. I wanted to note here while we're waiting for people to answer that there is a difference between depression and grief. Grief is a common, normal reaction to a change that we weren't expecting or didn't want. Grief, as you might know, can come from anything like the loss of a family member, a change in your career, a loss of a pet. But it can also be something that occurs when you're given a diagnosis that you didn't expect, if you're having more symptoms that you weren't expecting. And grief tends to be a bit more short-lived, and it's a normal reaction. Depression is something that can happen at any point, and it often persists even persists for longer periods of time. Okay. And okay. I'm not seeing the answer to the polling question yet. Oh, maybe it's coming up here now. Okay, here we go. So it looks like 71% of those who answered of our audience has experienced anxiety, so that's quite common. About half depression, and a little bit more than half stress, and then less than half was grief. So, it's quite common that people have experienced all of these symptoms. So I hope that if you're here, you're recognizing that you're not alone. And I did see some people said other, but I am not seeing anything in the chat. So maybe that's my technology ineptitude here. So apologize in advance if I missed what you wrote in the chat. Okay, we're going to go on to our next slide. So I wanted to describe the interaction between amyloidosis and mood a little bit more. I've started to highlight a few of the things in the past slides, but we'll go a little bit deeper here. When we're thinking about where our mood challenges come from, we can categorize them in either as primary, secondary, or tertiary. And the reason why this might be helpful is because it helps us to also figure out how to address the symptoms. So for example, the first one is primary. That means that the emotions that you're experiencing are directly impacted by the medical condition. So that could be something like if you have damage to brain tissue from bleeding on the brain, that might cause changes in your cognition. It might changes in personality, or might have some changes or like increase in emotions, such as depression. If you have hypothyroidism, that is a result of living with amyloidosis, that can lead to an increase in anxiety. So in these circumstances, the symptoms that we are experiencing are a direct result to the medical condition. So in terms of interventions, we want to really look at how do we address the diagnosis and maybe some resulting symptoms, and see if there's any medical interventions that might be helpful for addressing the medical symptoms and thereby might be improving your emotional symptoms. The secondary category is that emotions can be impacted by medications, can be impacted by treatments, or by symptoms of the medical condition. And a few examples are things like experiencing mania or hypomania after the use of steroids. Often people may, even if you've never had any kind of symptoms of bipolar disorder or mania or hypomania, and I'll describe what those two things are in a second, sometimes the use of corticosteroids can actually bring this on for the first time ever. And it's important to note whether or not that's happening for you, because you might want to talk to your medical providers, and there might be alternative ways of addressing symptoms if you are experiencing that. So the difference between mania or hypomania is mania is a little bit more of an intense reaction. It often results in lack of sleep or hyper energy or hyper irritability for days at a time, and persists around the clock. Hypomania is a kind of a more milder reaction, but not but still impactful. It might be that people are a little bit more talkative than normal. They may have more trouble with insomnia, but may be sleeping a little bit more. Maybe a little bit more impulsive than they typically are, but not kind of doing maybe aggressive, may not be as aggressive or impulsive as you might see with traditional mania. Hypomania, you might also see some increased irritability. And a second example is irregular heartbeats or racing heart or shortness of breath might be common symptoms that you are experiencing because of amyloidosis, but then that also those symptoms can trigger anxiety. And there's kind of a bi-directional relationship in this example. You might be feeling anxious, which might result in racing heart or shortness of breath, which then could make you start to wonder whether you're having physical symptoms. And it might be difficult to actually figure out whether these symptoms are coming from your medical condition or from anxiety. And so again, that can kind of create a kind of a vicious cycle, and it might be helpful to work with a mental health provider to sort of parcel that out or figure out how to address it when it's anxiety and when it is the medical condition. Now, the third one, tertiary, is probably what we think of when you saw the title of this talk. You might have immediately thought of this, which is that you might have an emotional reaction to the difficulty of living with a diagnosis like amyloidosis. So it's the emotional reaction associated with the challenges of living with the condition, role changes, or environmental stressors. So if you're having more physical changes, then that might mean that you're maybe having to leave work earlier than you expected or having to cut back at work. And so then maybe a partner or spouse is having to do more work, maybe go back into the workforce, or maybe there's less you can do around the house. And so, family members are having to pick up and do more than they used to. And so there can be changes in your role within the family, your role vocationally, your role with friends, and that can result in lots of challenging emotions. Things like fear of the unknown or uncertainty. So when you're living with a diagnosis like this, there's often a lot of uncertainty and unknown. There's maybe waiting for new treatments to come out and not knowing when that's going to happen or whether you will benefit from it. And changes, as I mentioned, in family roles might trigger thoughts of not wanting to be a burden. So this probably is the most common way that people think about mood changes, but I wanted to highlight the first ones, the primary and secondary, because as a health psychologist or rehabilitation psychologist, what I tend to do is I want people to make sure that they're getting all of the medical side checked out along with working with me, because if there's something medically that's causing the symptoms that you're experiencing, we don't want to just keep talking about it, and that won't necessarily change it. We want to make sure that we're addressing the root cause. Okay. So we have another polling question, which is, which of the three areas do you think has impacted your mood from the way that I've described them? Primary, meaning the disease itself. Secondary, any medications or symptoms, medications that you're taking or symptoms that you are experiencing. Tertiary, an emotional reaction, role changes. You can also put all of the above. Or you can write it in the Q&A.
Hi, Megan. We did find out that the chat for some reason is disabled, so people can certainly add in the Q&A.
Okay, sounds good. So
That's
yes,
working.
add your comments into the Q&A, and I'll try to pay attention to that so that I can comment on anything. Okay. So as you're kind of filling those things out, I also wanted to mention, I think I said with the tertiary piece, there's the emotional reaction, role changes, and environmental stressors. And one of the things that we know from research is that a good portion of how we feel is influenced by the environment in which we're living in. So that's the relationships that are around us, what's going on in our communities, in our social circles, whether we have enough money to pay the bills, whether we have enough to eat, those kinds of things, how challenging it is to get around your environment when you have symptoms. So really paying attention also to what influences the environment is having on you can also be helpful. Sometimes small shifts in environment or kind of adding in some extra assistance around the house, having some education or communication with family members can really have a big impact on our mood, because if our environment is slightly shifted, that might actually help us to tolerate what's happening to us a little bit easier. So here's the results of the polling question. It looks like most people have experienced all of the above, or at least a third of people. Around a third also the emotional reaction, less so from medications and some from the disease. I'm going to check the Q&A just to see if we have anything here. It's hiding from me, so.
Megan, I can tell you,
Sure.
Somebody said guilt, and then feeling like a burden in the home is a huge source of sadness for me. And then someone else saying it's so new, it's a lot to think about.
Yes.
And I've had to change my self-perception from a sturdy, can-do guy to someone who is frail.
Yeah, so there can be a lot of overwhelm, and then even self-identity, it sounds like how you view yourself can be a big impact. Yeah, thank you for bringing those points up, Kay, and those who wrote it in the chat. Okay, so now we're going to focus on what do we do about all of this? So there are lots of different strategies, and this could be several weeks of a talk if I was to go through every potential strategy that you can use. So really what I'm going to focus on are three main areas, which is values, something called dialectics, and something called committed action. And let me give you a little bit more information. Oops. I don't know why that just came. Okay. Oh, shoot. There we go. I just ended my presentation accidentally, so sorry about that. Okay, there, I think we're back. Um, Thanks for bearing with me, my technology snafus there. Okay, so there are two building block skills that I think are very important, especially when you're living with a chronic illness. Many people hear something called cognitive behavioral therapy. CBT, as kind of a quick reminder, if you're not, or if you are familiar with her, and an introduction if you are not, is that you have thoughts. That's the cognitions. Those thoughts can influence your emotions. Your thoughts and your emotions can influence your behavior. And sometimes your thoughts, your emotions, and your behaviors can impact your body and physical sensations. All of those sort of are bi-directional relationships, but in CBT, what we're trying to do is to change our thoughts, to notice what the thoughts are and try to shift them, so that we can then have an impact on emotions. CBT is great. There's lots of great research behind it. One of the things that I don't love about it is that when you're living with a chronic illness, sometimes the thoughts that you have are real. So if you have uncertainty about the future, that can be real. And so while we might be able to have some shifts in our thinking, I think that having some other tools in our tool belt can actually be more helpful than just trying to think our way out of it or change the way that we think. So these are the tools that I'm going to present here. So one of them is identifying what your values are, building on what you can do, what you can still do. And dialectics comes from something called dialectical behavior therapy, which is acknowledging that two things can be true simultaneously. So for example, we can acknowledge both grief and simultaneously, while feeling grief or feeling sad or feeling frustrated or angry about the diagnosis that we have, we can commit to behavior change, and we can do things while also experiencing the emotion. So let's start with values. I wanted to kind of share a quote from somebody who's very famous in the act. This is called acceptance. This is pulled from something called acceptance and commitment therapy, but is kind of a famous person in the ACT therapy world. He says, "Our values are like continents on a globe of the world. No matter how fast you spin the globe, you can never see all of the continents at once. There are always some at the front, some at the back. From moment to moment, you get to choose which value comes to the front and which moves to the back." So what we're talking about here is we want to identify what's important to us. Our values can be kind of like a compass that keeps us looking and moving in a direction that brings us meaning, value, and hopefully joy and contentment. But even if you're not in a place of feeling happiness, joy, or contentment, if you're continuing to act within your values or behave within your values, you often can have more quality of life than if you have sort of no compass at all. So often when I start to work with people, we will identify what's important to you. What are some of the values that make life worth living? So examples of values are things like courageousness, fitness, or taking care of your medical health, humor, kindness, curiosity. If you're not sure what are your values, I often ask people to identify activities that bring them joy, satisfaction, or contentment, or activities that used to bring you joy, satisfaction, or contentment. You want to identify what are some underlying core reasons that those activities are meaningful, and then identify new ways to incorporate those values into your life. So for example, I worked with a nurse at one point who said that that she loved the idea of helping others. And even though her medical condition was causing her to stop working, we talked about that value of liking and wanting to help others. Maybe we could find some alternative ways of bringing that value into her current life. Now, I know that that's easier said than done, and so I will I want to acknowledge that there is also, again, this and perspective. There might also be grief and loss in not being able to do something that you used to enjoy in the way that you used to do it. I'm going to have us do another kind of interactive experience. So we're going to write it in the chat. And Kay, if you can help me, if you see anything in the chat, please feel free to just highlight a few thoughts. I want you to name a value that is important to you. So I highlighted the ones that were on the last slide, which is courageousness, maintaining your health, humor, kindness, curiosity. Other ones might be things like assertiveness or caring, compassion, fairness, freedom, generosity, persistence, respect. So if you can think of one thing, a value that's really important to you, I'd love for you to write it in the chat and then just have Kay call out any that you see.
Okay.
Okay.
Not seeing any. Whoop. Someone said learning, being open to new things.
Love that. Learning, being open to new things. That's great. Okay. Well, I'm going to move on to a case example. And John, in this case example, is a 62-year-old retired teacher, used to enjoy his morning walks around the neighborhood. But lately he finds himself stopping every few minutes, struggling to catch his breath. His legs feel unusually heavy, and he has a strange tingling in his feet, which makes it hard to keep his balance. He feels frustrated and confused and wonders if he's just out of shape or if there's something more going on here. So I'm going to take that a little bit further. If I were working with him, one of the things that I would be doing is identifying reasons why walking was so meaningful and why it is so meaningful. So he might say something like opportunity to be in nature, enjoyed just feeling the sun and the breeze, enjoyed socializing with neighbors, so being able to say hi as he was walking around the neighborhood. And so these things that made that experience enjoyable, we might start to find, are there alternative ways to bring that into your daily activities so that you can continue to feel some of those threads throughout your life, even if you're not doing the same activity in the way that you used to do it. Now, maybe he can work with a physical therapist to better understand what the symptoms are and whether it is safe to continue walking. That sometimes physical therapists can help you to kind of test the limits or understand what your heart is doing, understand whether or not this is, answer that question that he had of whether or not this is just him being a little bit out of shape or, if he needs to take more care. Maybe a physical therapist might suggest a way that he can walk around his neighborhood or move around his neighborhood in a safer way so that he doesn't have to give it up entirely. He might also consider inviting neighbors over to sit on the porch in order to socialize, so then he can hit two of those things, being out in nature, feeling the sun and the breeze, or all three of those things, and enjoying the companionship of neighbors. But I'd love for you to also think about this. If you were talking with John, what are some other ways do you think that he could incorporate these ideas, the things that were meaningful to him about walking around the neighborhood, being in nature, feeling the sun and breeze, socializing with friends? So I want you to kind of think flexibly and creatively and see if we can pull some more ideas out for John. Feel free to write them in the chat. And Kay, if you see anything, feel free to just jump in and say it to me.
Okay.
But I'll keep going just so that we don't lose track of time.
Someone said plant a garden. That's one.
Love that. Yeah. So I mean, that's even a great suggestion because you're also being creative and you get to see something that you've developed and created kind of come to life, which I really like.
And also put nature sounds on his computer, our plants in the house. So
fantastic. Yeah, these are great suggestions. I love it. Okay. So I've mentioned this idea of incorporating and And I wanted to kind of put that into a little bit more context. There is, when you're living with something like amyloidosis, there is going to be grief and hard emotions. And there are opportunities for change or committed action or behaviors that can be helpful to you. When we combined acknowledging the truth of what's happening, plus what are some ways that we can problem solve, we get to a place of acceptance. Acceptance, I often hear from my patients when I say anything like the word acceptance, I often get a lot of pushback. And that's because I think acceptance often feels like it's something like you have to like this. You have to be okay with this. So if you accept something, you have to feel like you are you're not still upset about it. And that's not the case at all. Acceptance means you're acknowledging the present reality and you're continuing to commit to being a part of your everyday life. So it's okay to grieve. It's okay to not want this disease. It's okay to not want the condition. It's okay to feel frustrated. And it's also okay to acknowledge those feelings while learning to live with the disease and doing research about it. It's also okay to acknowledge those feelings and start to problem solve how to use modifications or to get around challenges or to find workarounds. So an exercise that I often use with people is a little bit less concrete maybe than the last one, but to incorporate and is we want to try and flow or move between seemingly opposite ideas as is needed. So if you have a particularly bad day and symptoms are really flaring up and there's a lot of fear and uncertainty and anger and frustration, set time aside to acknowledge those feelings. It might be 5 to 15 minutes. It might be a few hours. Maybe even it's a few days if you need it and it's a really hard thing. So you want to set some time aside to grieve when it's needed. That can look different for every single person. That can be that you need to just spend some time alone. That can be that you need time to journal. It could mean talking to a close friend or loved one that you feel is trustworthy. You need to kind of figure out for yourself what it is you need when you're feeling a lot of grief. Sometimes it's helpful to name the emotions that you're feeling in order to acknowledge their presence. A lot of people just try to stuff them away or ignore them or avoid them. And that often causes them to come back more frequently and more strongly. And then once you've kind of acknowledged what you're feeling, without judging yourself, we often kind of call this unhooking from our grief, which means or unsticking from our grief. These emotions can be very sticky and they want to keep coming back. You want to kind of gently sort of pull yourself and away from that and kind of look or direct your attention elsewhere. That might be towards problem solving the solution. So do I need to call my doctor to kind of have them let them know about these new symptoms that I'm experiencing? Do I need to figure a way to problem solve these household chores that aren't getting done? Or kind of just kind of moving to something that is more pleasant in the present moment. So eating something that tastes good, watching a funny movie, listening to some music. Sometimes the unhooking can just be, I need, kind of redirecting your attention to something pleasant. So a case example for this would be Emily, who's a 63-year-old artist who has always found peace in painting. But lately, the stiffness and numbness in her hands make it nearly impossible to hold a brush. Frustrated and grieving the thought of giving up her passion, she considers putting away her easel for good. She talks with a friend and names her feelings. She's feeling fear, frustration, and grief. She doesn't want to learn a new way to paint. She's angry about the fact that that's even something that she has to consider. And, big and there, She doesn't want to give up her passion. She talks with other artists and an occupational therapist. Occupational therapists can also often help us find new ways to do things, or tools or strategies that can help you do the things that are important to you. She decides to try larger brushes with padded grips and experiment with digital painting. And in here I put, she talks with other artists, because I often find that if you talk with people who are living with a similar condition to you, or you talk to people who have similar passions to you, they might have ideas or ways to problem solve the challenges that you're having that you didn't think of. And I often find that sometimes those people can be more helpful than working with professionals sometimes. But working with a professional can also help you in that respect. The unwanted feelings do not go away completely. And I put this in here because I really want to highlight the fact that we may not be fully erasing the negative or unhelpful emotions that you're experiencing. But each time they come, she acknowledges them and acknowledges her values and reasons for continuing to try in a new way. So we don't have to stop feeling bad before we commit to acting within our values or doing the things that are important to us in a new way. And often that can bring enough quality of life to help kind of pull the depression back a bit. So I'm going to end kind of with this idea of that is kind of rooted within the idea of acceptance and commitment therapy, which is a type of therapy that I think is very helpful for people living with chronic illness. So if you are looking for a mental health professional, you can look for that ACT, or acceptance and commitment therapy. But infused in that is something called willingness. And willingness is the idea that you are going to kind of keep yourself open. That might be open to lots of different things. It might be willingness to experience the spectrum of emotions, as opposed to avoiding or trying to fight unwanted emotions. Often I find that anxiety, depression comes from us trying to get away from the things that feel very uncomfortable, that are really scary, trying to push them away, or just fighting against the reality of what we're living in. There's an idea of a metaphor that's often used in acceptance commitment therapy, where there's a monster and then there's a person, and in between these two there's a giant pit, and there's a rope connecting, or the monster and the person is holding on to two ends of the rope. And in this metaphor, the person is pulling and trying to get the monster into the pit. If the monster goes into the pit, it is gone, it dies, it's gone forever, and then they can turn and live their life and they don't have to worry about it anymore. So in this idea with chronic illness, I often hear like, until I get these symptoms gone, until I get this disease cured, I really can't live my everyday life. And so that's what we're talking about. They're trying to pull that monster into the pit. But as the person is pulling, they're getting closer and closer to the pit. They're being pulled towards the pit. And all around them is the whole wide world, right? They could drop the rope at any time, and the monster would still be there, sometimes in their face, sometimes in the background. It wouldn't be pleasant. It might be following them around, but if they could continue to move towards people that they enjoy being with, places they want to visit, activities they enjoy being with, the activities they enjoy doing, the monster may not be gone, but you are still committing and being engaged in your everyday life, rather than yourself kind of being pulled into this pit. So I don't know if that metaphor helps anyone, but sometimes I find that idea of us fighting against our present reality so hard keeps us from engaging in the things that are most important to us. So willingness is willingness to try things, learn something new, even relearning how to do everyday activities, And these things might in and of themselves bring frustration or uncertainty, but we want to acknowledge this and commit to trying or being willing to try this anyway. So I'm going to just provide some resources, and I'm happy to have the ARC team send these slides out if they're helpful. If any of this seems like it could be helpful and you want more assistance doing that, therapy can be a great way to work through these challenges. There's also lots of great YouTube videos and books and things like that that talk about these kinds of topics in greater detail. I often recommend working with a mental health professional if you're going to do it that has experience in chronic medical conditions, someone like a health psychologist, rehabilitation psychologist, which really just means that they're people who are trained to work in a rehabilitation setting, like in a physical medicine and rehabilitation setting, like people with acute or chronic illnesses. Neuropsychologists, social workers, or licensed professional counselors that have experience with medical diagnoses. You can find these usually through your patient advocacy organizations like ARC. There's something called the National Register of Health Service Psychologists. The APA has a psychologist locator. Psychology Today. There's something called PsyPact. So if there isn't somebody in your immediate area, if you're open to doing telemedicine, PsyPact allows you to see people across state lines. So you might even look in a different state or at a major medical center that has health psychologists at their academic medical center. That could be an option for you. And finally, I want to also quickly highlight that all of these things that I talked about were geared towards somebody living with a diagnosis, but we know that family members are also impacted by diagnoses like this, and sometimes just as much, right? You're all living with it. And so sometimes as a caregiver or support partner, loved one, it's helpful for you to also get support for any mood challenges that you might be experiencing. And I put together some YouTube links for different videos on some of the ideas that I talked about today, like acceptance and commitment therapy and dialectical behavior therapy, and some other ones there. So with that, I will end there, and we can move to some Q&A.
Thank you, Megan, so much. This was very, very helpful. And we do have a couple of questions that have come in. Someone wanted to talk a little bit about anger, about having to sort of go through seeing multiple doctors and just the kind of convoluted process that goes along with diagnosing this disease. And just wonder if you could speak to that a little bit, kind of the anger and anger management.
Sure. So I think anger is often a mask, or not even a mask. I think it's the armor for protecting us from really vulnerable emotions. And what I mean by that is when you're having to go through seeing multiple doctors, it might be you're waiting weeks and weeks and weeks to find out what's going on, or you get a test result and you're waiting for the answers back, or you get a new test result. I was just working with somebody today who went in and got a test for one thing and then found an incidental finding, and then now they have to see another doctor, right? And so it's just like this continuously feeling like never-ending loop that you're on. So that can, number one, feel very scary. It can feel very uncertain. There can be anxiety associated with that. And often anger is a protective emotion. We pull that out to create some boundaries around ourselves. And in some cases, it can be a little maladaptive, meaning that if we aren't comfortable examining what those vulnerable or softer emotions are, then we can utilize anger as a way of kind of protecting ourselves from them. And, it can also be, it can show up, especially for men, it can show up when irritability and anger can show up in instead of sadness and in terms of depression. So
Mhm.
in terms of anger management, that could be it's a whole talk in and of
Yeah,
itself.
right.
But I would say kind of noticing what your triggers are, um, seeing if you can kind of like calm your physiologic reactions. That might be doing some slow breaths. And that doesn't mean that you have to do meditation or anything like that. You can just take some long, slow breaths. We want to kind of catch anger before it gets to 100. So, if you can notice like how your body is starting to feel, and if you start to feel some um, kind of a little bit of tightness in your chest, or things like that, then you might want to implement some strategies before you kind of go off the deep end. Also, if you Google anger management manual, there are some like free manuals out there with some exercises that people can do specifically for anger management.
Great. Thank you. I also had a really interesting comment, or that I'd love for you to talk a little bit about. Someone mentioned acceptance seems like surrender.
Mhm.
So would love to just kind of hear your thoughts on that.
Exactly. I mean, that's what I hear all the time. Acceptance feels like you're giving up. Acceptance feels like you're okay with it. I actually would love to shift our perception of acceptance, as rather than kind of like a passive emotion, as something that's more of um, as something that's you're committing towards action that's going to help you. So again, it's kind of this idea that we are acknowledging, not being okay with, but we're acknowledging the present reality, and then we're figuring out what to do with that. So there's some problem solving involved, and that to me is what acceptance is. It's not just being okay with it or giving in. If you're giving in, or you're sort of like kind of letting go, then you might not be going to doctor's appointments. You might not be going to your physical therapist. You might not be taking the medication. You're kind of giving up. There's some committed action involved in accepting what is happening in your life.
Thanks. We did have someone ask about this, of talking about being from a caregiver perspective. And I know you mentioned that obviously this is not just affecting the person that has been diagnosed, but it affects the caregiver. But someone said, I really worry about my spouse, but I don't want to mention it. So what would you suggest in kind of starting that open communication about being worried and concerned and that sort of thing?
Mm. It's a hard one because I tend to I tend to think that it's most important for there to be kind of radical openness in some ways with when you're living with a chronic illness, because um there tends to be this pattern where one person is living with a diagnosis, they might feel frustrated and angry about living with it. Maybe they're even feeling guilty about how it's impacting their spouse, or maybe they're not doing as much as their spouse wants them to, but their spouse doesn't want to tell them because they feel like they're already living with enough, right? And then that tends to keep people siloed and sometimes moving further apart. And so we often have to find a way to communicate in a way that both parties can avoid defensiveness,
Mhm.
but that you can partner together against the disease. Um, when you can partner together and problem solve together what to do, then it's neither person is taking on the load. You're taking it on together. That's easier said than done. So sometimes it's helpful to kind of bring up concerns in front of a medical provider, or um, it with somebody else around, so that there's
Mhm.
uh, some extra support. It's sometimes kind of very small comments at first, or acknowledging what the other person might be feeling. So I know that maybe you don't want me to be bugging you about going to the doctor, or taking your medicine. I tend to worry, and I just want us to figure out like maybe how you can help me figure out how to manage my own worries, right? So if we kind of put it on the other person helping you, then sometimes they're more open to that. But again, it's very individual, and sometimes that needs like a deeper discussion.
Right. Great. Thanks, Megan. Did have one. I'm going to take a look at the time. We're good. I have somebody who said, I've come a long way in my acceptance, but I haven't accepted the loss of my physical fitness and being able to exercise. Do you know how to replace that dopamine rush and the mental health benefit that came from that type of exercise?
Yeah, that's a hard one too. Yeah, because for example, I worked with somebody a while ago who was a runner, and so like that the their love of running, they always had this good rush after running, and they never really kind of they were coming to me saying that they never really experienced that same kind of sensation with other types of exercise, even like using weights or something like that, which they were able to do even though they weren't able to run anymore. Um, I tend to think that sometimes it's experimentation, um, and seeing if there's something else, like maybe even doing something like a uh, adapted sports kind of program and seeing if anything in there could be helpful. I have somebody that I worked with who, uh, like did some things that maybe were a little bit more dangerous, but I think on the balance of okay, but kind of gave that kind of rush, like we're using a scooter and those electric scooters and hanging onto it and going really fast downhill, um, and or like driving. They have what's the word I'm looking for, but the top down on their car, and then you have kind of the feeling.
Convertible. Yeah.
So I think sometimes it's experimentation of seeing some other things, and it might just be kind of acknowledging the grief that's associated with that. If you're not able to find that something that replaces
Mhm.
that, it might be spending some time grieving the loss of physical fitness.
And I also did want to mention to everyone that we are recording this webinar. It will be available on ARC's website as well as the slides. So you will have access to that. So I don't think I mentioned that in the beginning, but just wanted to mention it is being recorded. One other question here, I think, and that may wrap us up, Megan, but you had mentioned, I think, journaling or having a journal as part of acknowledgement, and wondered if you could expand on that a little bit.
Yeah, sure. So there's some great research out there that journaling can really help with someone's mental health. And the reasons behind that is number one, it sets aside time for you to actually focus on what you're feeling and thinking. And sometimes when we get things out, some people do that by talking out loud to a friend, family member, a therapist. That can help you to sort of just hear what's going on in your own head and start to problem solve. But sometimes people do that by journaling. So you're getting it out of your head and onto a piece of paper. I often find that it is also helpful for people who ruminate, meaning like they're just kind of going over the same thing again and again and again. And so sometimes journaling can be very helpful because you get those thoughts out of your head. And sometimes if you do it in a structured way, so there's something called the SWAPS strategy, which is stop, what's the problem, alternatives and options, pick and plan. And if you're doing some journaling where you're saying like, okay, what's the problem? I'm writing down everything that I'm feeling and thinking. Now, what are some alternatives and options to that? And then you kind of do a brain dump, and then you can kind of go through there and pick and plan. Sometimes that is enough for you to sort of get out of that cycle of rumination. And a quick comment that popped into my head, which is kind of off topic, is to the acceptance comment question earlier.
Mm-hmm.
I have a patient who said she doesn't like the word acceptance. So she calls it begrudging tolerance. So if that helps anybody, you can replace the word acceptance with begrudging tolerance.
Could always look at things in a different way, right?
Yeah.
All right. Well, I think we are at time. And Megan, we've certainly appreciated your time today. You did a great presentation. I just looking, getting a lot of feedback. People enjoyed it, and we're very appreciative of your time today and sharing your expertise. And so again, just want to remind everybody that this will be, it is being recorded and will be on our website. And we look forward to seeing you all in April for our April webinar. So thanks again, Meghan.
Thank you, Kay. And thank you all for joining.